Clots in our blood vessels can be responsible for very serious health problems like strokes and heart attacks. To combat this, some people at risk of said health problems turn to blood thinners to prevent this clotting process, with the most common household blood thinner being aspirin. The issue with preventing clotting, though, is that should you start to bleed, that bleeding can be tougher to stop. Now, however, a new drug, Clopidogrel, is being touted as coming with the same benefits of aspirin, but fewer of the drawbacks. To talk us through this matchup, we put in a call to the British Heart Foundation's Dave Newby.
When you have a heart attack or a stroke, basically a part of an artery gets blocked by clot, either in the brain in the case of a stroke or in the heart in the case of a heart attack. So if you take a small dose of aspirin, it actually keeps the blood nice and thin and stops it causing blood clots so easily, and therefore it reduces the risk of a heart attack and a stroke. Now, there are some new drugs that have come along that are a bit more sophisticated than aspirin, and the one they were particularly looking at in this study was called Clopidogrel, and that thins the blood down in a slightly different mechanism, and some have suggested it might be more effective than aspirin. Now, when you use something to thin the blood, yes, it can stop a heart attack and stroke, but obviously if you cut yourself or you get bleeding, then the blood clot doesn't form so much, so you might increase the bleeding risk. So the question is slightly delicately balanced. Can you prevent heart attacks and strokes without causing too much bleeding? So they wanted to look at these two things, really.
How did they approach it?
So what they did is they looked all through the literature and looked for studies that have been performed comparing aspirin with Clopidogrel, and they looked particularly at people with heart disease. And these people with heart disease either had something called angina, which is a pain in the chest when you walk, or recently had a heart attack or a heart attack in the distant past. And what they did was to compress all of that data together from all the experience that we've had and analyze it in totality. So the amount of data they had was much bigger than any single study.
What was the outcome measure? Were they looking for, do people on one or the other of these drugs have more or fewer heart attacks or strokes, like you've been saying?
That's correct. And they also looked at things like whether people died. They also looked at whether the people bled to the same extent using these two different drugs. And the answer was that the death rate was the same in both groups. The bleeding risk was the same in the two groups. But they did see a slight signal that Clopidogrel was better at preventing the heart attack and the strokes. Now, to put this into perspective, the amount that it reduced the risk of a heart attack and stroke was quite small, around 0.4%. That's not to say that aspirin wasn't effective. It was just that Clopidogrel was slightly more effective than the aspirin.
So should cardiologists then be switching what they put people on, or do you think the evidence isn't compelling enough to justify using Clopidogrel instead of aspirin, because there will be a higher cost burden, won't there? Is it better to stick with aspirin, do you think?
Yes. So I think one thing to factor into all of this is aspirin costs about £1 a month to be prescribed that, whereas Clopidogrel is £35. You can sort of get it cheaper from some options, but that's the list price of £35 a month, so it's a lot more expensive. Clopidogrel also does have some side effects that aspirin doesn't have, which include having a rash and some diarrhea and things, although aspirin also has side effects and can cause allergic reactions in some people. So very often people tend to use Clopidogrel rather than aspirin in people who can't tolerate aspirin, or they're worried about bleeding. But as I said, actually, this trial shows that you're just as likely to bleed whether you're on the aspirin or the Clopidogrel. So I think my recommendation to people listening to this would be to carry on with your own medication. If you're particularly concerned, you could discuss that with your doctor or your cardiologist to have a conversation about whether it's right for them to switch or not. But I think, you've got tried and tested drugs, both of them. They're both essentially equally effective, but in this area of preventing heart attacks and stroke, the Clopidogrel has the edge on aspirin.
Aspirin has some value added, though, doesn't it? Because it also cuts your cancer risk and possibly your Alzheimer's risk, so you're actually getting more bang for your buck. So when you factor that in, I wonder if, in fact, there is still an edge for aspirin.
No, indeed. And as always with these things, they looked at a very specific thing in a very specific population. So you're absolutely right. There are other added benefits of aspirin that should be taken into consideration because at the end of the day, we all want to keep healthy. And those benefits you alluded to are equally important.
The BHF's Dave Newby on Clopidogrel versus aspirin, the clotting wars.